You wake up with a throbbing tooth. Your first move is a pill. You shatter a bone. A hospital gives you anesthesia. For us, relief from agony is usually just a few minutes away. But for almost the entire story of our species, through the vast expanse of the Paleolithic and Neolithic ages, that reality didn't exist. Our ancestors faced a world of constant, unfiltered pain. Imagine suffering a deep gash from a predator's claw, a bone-crushing fall during a hunt, or the brutal impact of a rival's club. With no ibuprofen, no morphine, and no modern anesthetics, how did they possibly survive? They were left with a pharmacy hidden in the world around them, with rituals that bordered on the magical and their own sheer will to conquer pain. So how did they do it? How did ancient humans navigate a life defined by severe injuries and daily threats? The answers reveal they weren't just primitive survivors. They were ingenious observers, desperate scientists, and the original pharmacists. Long before labs and factories, the entire world was a potential medicine cabinet. For Stone Age peoples, the key was knowing which leaf to chew, which root to crush, and which flower to harvest. This wasn't just luck. It was a science built over thousands of years of trial, error, and keen observation passed down through generations. The most famous example is willow bark. For thousands of years, from ancient Sumer and Egypt to Greece, people knew this tree held a secret. The Greek physician Hippocrates prescribed it to ease pain and reduce fevers around 400 BC. They didn't know the chemistry, but they knew it worked for injuries and ailments. Today, we know why. Willow bark contains salicin, which our bodies convert into salicylic acid, the substance that inspired modern aspirin. But for the agonizing pain of a compound fracture or a severe animal bite, they needed something stronger. In Mesopotamia, around 3400 BC, the Sumerians cultivated a plant they called hul gil, the joy plant. We know it today as the opium poppy. This knowledge was passed to the Babylonians and Egyptians, who used it to quiet crying children and soothe excruciating pain. They created pills, creams for wounds, or had patients inhale its smoke to endure agony. And this kind of discovery happened all over the world. In the Andes Mountains, pre-Inca cultures revered the coca leaf. They used it as a powerful local anesthetic, sometimes applying chewed leaves directly to wounds, or even the skull before surgery, a practice that deadened nerves using only the tools nature provided. But what happened when the pain of a grievous wound was so immense that chewing a leaf simply wouldn't do? What did they do when surgery, like an amputation or setting a shattered bone, was the only option left? Before the official dawn of anesthesia in the 1840s, ancient surgeons had to get creative, pushing their patients to the very edge of consciousness. The oldest and most widespread tool was alcohol. Early Mesopotamian sources suggest using beer and wine to sedate patients. It wasn't true anesthesia, it was a blunt instrument that induced a drunken stupor, but it was better than nothing when facing the surgeon's knife. More sophisticated cultures developed powerful cocktails. In 2nd century China, the legendary physician Hua Tuo was said to perform complex surgeries after giving his patients ma fei san, a potent blend of wine and herbal extracts like cannabis or hemp. In Europe and the Middle East, surgeons relied on the spongia soporifica, or soporific sponge. This was a sponge soaked in a potent cocktail of opium, mandrake, henbane, and hemlock. Held under a patient's nose, the fumes would induce a deep, unconscious state, creating a form of early inhalational anesthesia. But the dosage was unpredictable and incredibly dangerous. Long before it was common in the West, a Japanese surgeon named Seishu Hanaoka performed one of the first documented surgeries using a general anesthetic in 1804, a complex oral potion that allowed him to operate on breast cancer. These methods were a monumental, if risky, leap in humanity's war on pain. When potions and plants weren't enough, Ancient healers turned to startling physical interventions. The most dramatic of these is trepanation, the act of drilling a hole into a living person's skull. Archaeologists have found thousands of these skulls all over the world. For a long time, it was assumed this was purely a ritual to release evil spirits. But the evidence tells a different story. Many skulls show clear signs of healing, meaning the patient survived for weeks, months, or even years. In some sites in ancient Peru, survival rates may have been as high as 80%. This strongly suggests it was a medical procedure, likely used to relieve pressure on the brain after a head injury, or to remove shattered bone from a fracture, a frequent and deadly injury in a time of interpersonal violence. But their physical ingenuity didn't stop there. Healers also discovered a primitive form of electrotherapy. In ancient Egypt, doctors would use electric fish from the Nile, like the Nile catfish, laying them over a patient's wounds or head to treat pain. The shocks, they believed, could numb the area. The Greeks and Romans later adopted this practice, using torpedo fish, electric rays, for everything from headaches to arthritis. It marks the very first recorded use of electroanalgesia in history. Perhaps the greatest difference between the ancient and modern worlds wasn't in their medicine, but in their mindset. Today, we see pain as a malfunction to be silenced. For many of our ancestors, pain was information. It was a message from the gods, a punishment, or a sign the body was out of balance. This meant that healing was never just a physical act, it was a spiritual one. Healers were often both physicians and shamans. An herbal remedy might be accompanied by a magical spell to frighten the painful devils out of the body. The Ebers Papyrus, a famous Egyptian medical text from around 1550 BC, lists over 700 remedies and magical formulas side by side. This worldview also explains practices that seem bizarre to us. The famous Greek physician Galen promoted the humoral theory, the idea that the body was governed by 4 fluids and that an imbalance caused disease. This led to treatments like bloodletting, which aimed to restore balance by removing bad blood. It wasn't about simply stopping a pain signal, it was about fixing the cosmic imbalance that the pain represented, even if the treatment itself was painful and dangerous. So, how did ancient humans deal with a world of constant, brutal pain? They used the world around them, turning plants like willow, opium, and coca into the world's first pharmacy. They created intoxicating proto-anesthetics from alcohol and herbs to make surgery on terrible injuries bearable. They drilled holes in skulls to save lives from violent trauma and used the shocking power of electric fish to numb their aches. But their approach was fundamentally different. They didn't just try to silence pain, they tried to understand its meaning. While their methods were often brutal and their understanding incomplete, their story is one of incredible resilience and ingenuity. But maybe the most powerful medicine our ancestors had wasn't a plant or a ritual at all. Archaeological finds like the Shanidar I Neanderthal, an individual who survived for years with debilitating injuries, including a crushing blow to the head, an amputated arm, and profound hearing loss, suggests that the sick and injured were not left behind. They were cared for. This implies that the ultimate answer to how they dealt with pain lies not just in their medicine cabinet, but in their community. That the greatest anesthetic of all may have been the simple, human act of caring for one another.